morning. This isn't a program specific webinar. So a lot of you sent in great questions that had to do with very specific aspects of our UConn Neurology residency program. And so I will let you know that we will answer those, but in our program open houses. So hopefully if you are after today still interested in our residency program, that you will participate in one of our program specific virtual open houses. There's one, I believe it's next Tuesday, and the other one is the following week. So those flyers are available online as well. So that will be really to get to know our program, our residents, and to answer a lot of the program specific questions and topics that came up. So what I'd really like to focus on today is our questions that you sent to us specific to IMGs who are applying to neurology residency. So that will be the topic for today. I'm really excited that all of you that joined us today are interested, number one, in being neurologists. I think, you know, it's a really challenging time with the pandemic, and there's additional challenges that our international applicants are facing. And, but I really just wanted to recognize your resilience and all of your efforts in terms of pursuing a career in medicine and in neurology. I'm biased, of course, but I definitely think that neurology is the best, most exciting specialty to pursue in medicine. So, but obviously I'm biased in that regard. And I just wanted to let you know that I am going to answer a lot of the questions at the end, and I really want to have our faculty and residents share their stories with you and share their advice. So you know, it's my honor to be a program director in a program which is very culturally diverse across our trainees as well as our faculty. And it's, to me, it's an amazing place to work and to live. And, you know, I really want to continue to keep building our program in a way that really is supportive of our trainees and also recognizes sort of our diversity and all of our different backgrounds, because our patients also come from all different backgrounds. And it's so important to sort of live and work in an environment which challenges and enriches us, but also puts us in a good position to take good care of our patient population. So on that note, just to turn it over for the first part of this program, I'm going to go one by one. We have 3 faculty and 4 residents, I believe, that are currently on the panel. And I am going to introduce each of them. They are going to tell a little bit about their background, their pathway to becoming a neurologist or a neurology resident. And then I'm going to ask each of them, several of you submitted the question, what advice do you have for IMG applicants? And so I'm going to give that question to all of our panelists to answer when we do our introductions. I think after each of our panelists talk about their advice for you and give their backgrounds, then I will get to a lot of the questions which were common themes from what you all sent in prior to the meeting. All right, so on that note, I'm going to just sort of go across my screen in terms of, we'll start off with our faculty representatives, and then we'll move on to our resident panelists. So just in terms of my screen, so I have Dr. Thirssary next to me on the Zoom screen. So I'll turn the mic over to him, and he can give you some advice and tell you about his background.
Hi, everyone. Good morning. My name is Thirssary. I'm one of the vascular neurologists here at Hartford Healthcare. I was born and raised in India, in the state of Gujarat, and I did my medical education back there as well. And my journey here kind of played in part when my family moved here soon after medical school, when I followed them to the States, and I did my residency at University of Connecticut, this program. And I finished my residency, subsequently did my stroke fellowship at Yale, and recently joined Hartford Healthcare back as one of the vascular neurologists and the faculty members for the residency program. I will say that my general advice for the residency match process, especially as an international graduate, is this is definitely a challenging process in terms of, you know, everything that's involved with your applications and interviews and the whole match process. I think the biggest thing that is helpful in this scenario is kind of focusing on who you are as a person, kind of focusing on what your strengths are. And rather than, I feel, one of the scenarios or one of the viewpoints a lot of people look across is how can I be more competitive compared to the others? I think it's more about the best version of who you are. One of the most common questions we get, and we got these in the questions in the chat as well, is, what else do I need in terms of my application? What else can I do in terms of research and everything? But I feel as a applicant, especially kind of prior to pursuing residency, I think everybody understands, the limitations that you have in terms of, use clinical experience or research, for example. And I tell the medical students that work with us all the time is this is a whole process of getting you to a residency program that trains you as a clinician. And I think that probably is the biggest part in terms of, how you've been so far in terms of your clinical skills. And I believe the best way that reflects is the people that have worked with you kind of endorsing that. And I think that really helps kind of put a well-rounded profile, and that really helps you through the whole application process. I think having these sessions now in the COVID era, especially where we can connect remotely and kind of get to know programs, get to know people, I think those are great avenues as well, which can be really helpful in terms of you trying to navigate which program is really a good fit for me, and getting actually advice from people who've been on the other side in terms of who are still residents or have completed a residency, and kind of get their perspective in that regard.
Great. Thank you so much. Dr. Thirssary is a recent grad from our program. And, like many of our other internationally trained physicians, has really sort of excelled in our program and was able to pursue very successful fellowship and, pursue research and a lot of the things that he's very interested in terms of medical education and getting his career going now as a faculty member. So great advice. Thank you, Karan. Next on my screen next to me, I have Dr. Weinstein, who will also give some advice and discuss her pathway to neurology and her current career as a faculty.
Hi, good morning. So I'm Dr. Weinstein Younger. I am a faculty at UConn. I'm doing more neuromuscular and peripheral neuropathy. I am like Brazilian. I did all my medical school in Brazil, and then I finished my residency in New York in Queens Hospital Center and then Stony Brook. After that, I did my fellowship at Columbia University. I did 1 year of EMG neuromuscular, and then 1 year of peripheral neuropathy, and then I ended up at UConn. I think most of my training were in Northeast, and that's kind of like my one of my piece of my advice is like choose an area that you feel comfortable. You make friends, so I have my friends since residency since then, so it's much easier. And regarding the application process and everything, I think I was fortunate to do my clerkship rotations in neurology at that time, but we all understand that now it's much harder. So find other ways to show your passion to neurology, even your local school, that help us to evaluate your CV and what you did. Neurology, we are all fortunate because neurology is a very welcome field for immigrants. So if you see, I think most of the programs have a lot of faculty from everywhere in the world. Most of our faculties a lot of our faculties went through residency in neurology here at UConn and then came back. So it's nice to see. I think we're going to discuss later, but be yourself, show that you're unique. Don't be shy because you're immigrant. I think neurology, we are diverse, and that's very nice to see.
Great, thank you. That's great advice. Next on our faculty panel, we have Dr. Tangatori. So I'll turn the mic over to him.
Hello, good morning, everyone. My name is Dr. Tangatori. I graduated medical school from Hyderabad, India. And then the main reason for me to come to States was my brother, of course, as a family. And then I came here to do my master's in public health. And then while doing that, I also was able to get in some research and some observerships at the same time, which I had the luxury of. Unfortunately, don't at this time, but that's okay. Just focus on what you need to do is to get in touch with your alumni and see what program best fits for you. I mean, if one of your alumni is already in the program, then the chances of you getting in there would most likely be high because the program has seen a person from the same college, so they understand the education and everything else. But the biggest, I don't know if it's a mistake, but when I applied, I applied to multiple programs, every program that fits my criteria, my scores, and everything graduation year. I think that was a mistake retrospectively, just because rather than throwing my application blanketly, just focus on programs that you have high chances for, like talking to the residents or reaching out to alumni and see what the program looks into or what the program is interested in. And if your interests align with the program, that you have a best match there.
All right, great. Thank you, Dr. Tangatori. So next we have some of our resident panelists. So first I'll introduce Dr. Shivani Sodani.
Hi. Thank you, Dr. Schuyler. My name is Shivani. I'm from India, so born and raised in Mumbai. I did my medical school away from Mumbai in a city called Pune. In medical school, essentially, I think early in medical school, I decided that I wanted neurology. And then in the latter half, after doing some of my clinical rotations, I decided to come to US. I did a few electives while I was in medical school and in observership after graduation while giving my steps. And then the same year, I think I applied. And then I actually belonged to a batch which was the first batch from my medical school applying to US. So honestly, I was very fortunate that I was given this chance by Dr. Schuyler to essentially to come here to match. But obviously, as an IMG, it's very stressful, especially not just because you don't have any of the seniors to guide you and stuff, but also because I mean, it's a new country, it's a new place, it's a new system. So essentially, but once you actually start interviewing, you realize that people are really laid back. I mean, essentially, just try and be yourself because you have to stay there for like 4 years. So it's not just be yourself in the interviews, reach out to residents. With this virtual world, I think it's easier to be I mean, it's easier to access the residents and talk to them, see how the program is. And essentially, if it's a fit for you, then you should apply there, you should go there, let them know. And a couple of my friends last year who applied in the pandemic, actually, they didn't have the opportunity to do observerships here, even they interviewed virtually. So they actually, what they did for neuro experience was back home, they did a couple of rotations with the neurologists over there. So that can help you too. So you can do that for sure. And that's really it for now, I guess.
Great. Thanks, Shivani. That's all really good advice. And to hear from somebody who was just through the process somewhat recently, and that you have friends that applied last year that were successful matching even without doing US observership. So I know that's a question that quite a few people sent in questions about that. So next on my screen, I have Dr. Nida Akram.
Good morning, everyone. My name is Nida. I'm one of the PGY3 neurology here at UConn. Originally, I'm from Multan, Pakistan. I did my med school in the same city. During my med school at Worcester Medical College, I did do an away rotation here in North America. I definitely liked the system here. Once I graduated, I moved here as a family, moved with parents and siblings. Initially, I was able to get a job. It was more so in the quality improvement department of Comprehensive Stroke Center. It was crucial to give me the US health system experience, but also to recognize that I was interested in neurology and vascular neurology, something which is I had a limited experience back home. I did some rotations here, some publication through my job, and I ended up at UConn. So from my experience and from what I have heard from my friends, I mean, we all know it's a bumpy road, but once you get masked, you start forgetting those bumps. But persistence is important in whatever you do, whatever you can do. Pandemic is limiting a lot of stuff, but do what you can.
Great, thank you, Nida. Next, we have Dr. Mohamed Afifi, who's one of our junior residents.
Hey everyone, my name is Mohamed. I'm from Egypt. I was born and raised in Egypt. Graduated from Tanta University Medical School in 2016. I did some away rotations here in neurology, which made me fall for neurology and wanted to come and practice here in the US while I was in medical school. And then after graduation, I came here to do some research as well in epilepsy. And afterward, I was fortunate enough to match into neurology residency here at UConn. If I go back and if I give an advice for people who in the same shoes that I was in once, it would be to not just focus on matching or not, it would be to focus on where to match. I think I probably, before the match started, all I was thinking of was matching. I just want to match. And it's, of course, believe it or not, most of you are going to match. So just take a breath and believe it that you are going to match. I think the most important thing once you start the match process is to focus where do you want to match. Choose your program wisely. I think that's the most important piece of advice I would have asked for back then.
Okay, thank you so much. And that I think is a good segue to our questions. So I'm going to turn this one over to some of our resident panelists. So you said, to really look into what program might be a good fit for you. So I was wondering if our resident panelists could each say a little bit about what kinds of things that you look for. I know that it's a little bit different now than it was a couple of years ago with virtual. And this is a good thing for applicants, which is that since things have gone virtual, programs have been forced to put everything they can online, right? So there's much more information on our websites. A lot of programs have developed social media presence, made videos, made virtual tours. So I think that there is really a lot out there compared to maybe a few years ago. It was really sort of, you could see the basics of a program, but it was really not until the interview that you really learned more of the details. So I think that that's something that's really changed over the last couple of years. And I want to make sure, for us, a lot of the questions, and it was great seeing all these questions sent in, and it will help me to update our frequently asked questions. So I go in every year and do significant updates to the frequently asked questions part of our program website. So it gets bigger every year. I just was working on updating some of it and updating it a little bit more for the pandemic, but having these questions is really great because it gives me a sense of what you really want to know from the programs. So that's very helpful. So to turn it over to, I guess, Mohamed, if you want to, you just mentioned that, but if you could tell us, and then Nida and Shivani, a little bit about sort of what are some things that are really important, I guess as a human being yourself, but also as a international physician, what are some things that some sections of the websites you look at, or if you contact residents from a program, what are some important things to ask them about? So if the three of you could kind of touch on some of those topics.
Yeah, absolutely. So like I was saying, the moment you start interviewing with a program, it's not just about them interviewing you, but you also interviewing kind of the program. And I remember one of my first impressions about the program here at UConn is one of our senior residents right now in BGY4, that I looked at him in the dinner, and he was happy. He was here in his BGY2, and he was very happy being here. He loved being here. He felt like he's completely supported by the faculty, and he had good interactions with them. Whenever he needs them, they are there for him. There is a good sense of camaraderie between the faculty and the residents, and as well as our program coordinator, Tina. So I think that was one of the first things that I was looking for. When I'm stepping in, and I'm not stepping in a hostile environment, I feel like I'm at home, especially for someone like me who comes from Egypt. I have no family here in the US, so my program is sort of my family. And I was fortunate enough that the class that matched with me, I feel kind of like similarities between me and them. Most of them are IMGs as well, which is, I think, the second thing I was looking for in a program that has, I don't want to go to a program that I'm the first IMG that matched there. I think it's a good thing. Perhaps, yeah, it's a good thing to be the first person to do anything, I guess. But as well as, I think, for me, I think going to a program where the idea of an IMG, the presence of an IMG is not unfamiliar to the program or the program director. There are also other things, and it's tailored to the person. One of them, the city you live in, especially as an IMG. I think all my perspective is from that perspective, an IMG perspective. The city you live in is going to matter the most to me. Am I able to have people with similar backgrounds as me around me in the city? This is something that you need to make note of in your mind. And there are also other stuff that are very specific to the program that you could look at, such as the schedule, the kind of rotations you want, and the didactics for the program. And I think it's very important to keep an eye on those, because if, let's say, you want to do stroke vascular neurology in the future, you would want to go to a program that really has good grasp about these and can learn about this just from residency before you even do your fellowship. And that goes for even more the uncommon subspecialties, such as cognitive, for example. Or if you want to do IR, you need to go to a program who has good exposure here with something like that.
Great, thank you, Mohamed. Nida, anything that you want to add, specific things that our applicants should look for, or aspects of programs that are important to look at?
Sure. I would say, based on my experience back then, I know when you're applying it as an IMG, you're desperate to get matched and you apply broadly. But I would still say, get it focused. Residency can be stressful. It is for 4 years of your life. You want to know where you're living. If you have family and friends in US, try to prioritize the program closer there. If you have special interest, try to focus your interest in those programs that have faculty specific to that particular subspecialty, or that is more focused on those areas. A friendly vibe from the program or the resident was very important to me. I am family oriented, so if I am getting the vibe that I can be comfortable from that standpoint, then it's a good one. It's not about, for me at least, it's not about what name you're going up. It's more about where you're more comfortable and where you are okay spending your 4 years of life.
Great, thank you. And Shivani, are there specific things you can recommend for our applicants to look for?
I think Afifi and Nida sort of summarized it very well. Essentially the main things, at least for me, was speaking to the residents. I know that right now it's not sort of in-person dinner, but the virtual dinner would be a big thing for you guys. And that essentially, the dinner for me was the place where actually I decided, okay, this is the place that I'm going to go, because the residents were so happy and sort of so friendly with each other. And because you have to spend 4 years, so you have to be sure that you'll be comfortable there. 100% I agree with these guys that obviously we're all stressed out and we're the only thing that matters is honestly just to match wherever it is. It doesn't matter. But once you start residency, you realize that that makes a huge difference. Then as IMGs, we never look at the schedule. We never ever pay attention to it. We're we don't care, wherever we match, it's fine. But you do have to look at that. Try try and see if PGY2 usually for neuro would be inpatient heavy, but try and see if you get more subspecialty and elective exposure. We were lucky in our program. I mean, our schedule is set like that by Dr. Schuyler that we get more exposure, but essentially try and see that as well, so that when in fellowship, when you're applying in third year, you have more exposure and you essentially you get enough time to decide where you want to go. And then I think that's really it for now. Yeah.
Great, thank you. Now from our faculty panelists, are there specific things that now, having gone through the whole process through residency and fellowship and now being on faculty, to look at, what are some things that you think are most important for our applicants to look for when they're kind of researching all the different programs? There are, I think, 160, something like that around there, out there. And so, so there needs to be some good ways to kind of put together your priorities and then kind of pursue it that way. But what are some things that you would recommend? I guess Dr. Thirssary, what, and then we can go to Fernanda and Ajay.
Sure. I'll echo a lot of things that our residents have said. And as you go through the whole match cycle process, once your application started and you start going through the interviews, I think this is in the end about you finding a good fit for yourself. And then I think on the other side, that's what the programs are also looking for. I think you already kind of communicate what your academic accomplishments are and, what your scores and everything is already there on your profile in terms of things that programs can see. I think the second part of this process, I feel, is trying to us knowing you as a person, and I think the applicants kind of doing the same, kind of trying to get a sense of how the culture is in a program, how people interact with each other. I think when you do in-person interviews, I think that's one of the very big things I always used to tell residents and students. And personally, what I used to kind of keep an eye for is, just go to the hospital and kind of see how people are interacting with each other. And I think that's a big thing, because I think most programs, and just because of how ACGME has things standardized, you'll get a pretty decent or pretty kind of equivalent kind of educational experience in terms of exposure that you get. Most of these neurology programs, I mean, everywhere you go, you'll have board certified neurologists who are training you. But I think that's where it kind of comes down to more as you kind of getting a sense of what the camaraderie is between the residents, what the work culture actually is, what's the diversity and the strength of the faculty that you have. And especially if you already have some experience in terms of certain subspecialty, and that's what your career goals are, I think it's helpful to look out for that. There are a few programs that are more research heavy. I would say that most of the programs definitely focus on the clinical aspect first. And I personally feel, I think that's what the focus should be on. But I think you also need to keep an eye on, if you have X, Y, and Z interest, kind of how does that program work out for you? And beyond that, I think you had to be mindful about your life outside work. So how does that work out in terms of the geographical area that you're living in terms of all the other family aspects that matter for you? If you have family on the East Coast, going up to the West Coast, is that something you really want? I think these are legitimate things that you need to kind of address for yourself. But I think that's where it kind of comes down to and boils down to something like you need to find what program is really a good fit for you. And ultimately, I think as you go through your interviews, I think that's what you kind of try to assimilate and understand, this is where I definitely want to be. This is where I'd be happy for the next 4 years. And this is where I feel I can definitely make the next step in my career.
Great, thank you. I just wanted to add, because that brought up the point about trying to, get to know the program and their vibe. I know that virtual is not the same as coming to visit, but I was pleasantly surprised last year at how well we were able to really connect with our applicants over Zoom, as well as with the sort of the social hour we have. So we don't have an in-person dinner now, and that is a key component for in-person visits. Now that we're doing virtual, being able to do sort of a Zoom social hour, I think it's not the same as spending, 3 hours out, sitting next to somebody, having drinks and relaxing, having dinner with them. But, I think it was better than I thought it would be, just in terms of how well we could sort of get to know people over the virtual setting, and how you can sort of still, by meeting with a group of people, it's really more about the people, I think probably than the physical space of the hospital, just in terms of, how comfortable people are, how supportive they are of each other. I think we are able to hopefully communicate that over the virtual platform. And obviously every hospital has a cafeteria and a call room and all that stuff. And I think a lot of programs made, and we did too, made a virtual tour just showing, videos of what all those places look like as if you were going on a tour. Here's the cafeteria, here's the Starbucks, here's the, here's the nurse's station, here's the ICU. But really, hopefully you'll be able to get a good sense of, the culture and sort of the vibe. That's the word most people are using now in terms of what a program is like. Fernanda, do you have anything else you recommend for them when they're researching programs?
Yeah, I think a couple of things I want to add is like check on the website profile, the faculty, where the faculty came from. Maybe somewhere like where you share the same like med school and you can work on your network. So contact those faculty or maybe a resident like, oh, do you remember me, or have someone in common? So networking in this process is very important. And I think that helps. Another thing is not what you look for in the program, but make sure your application is perfect. Most of us are not native English speakers, so make sure someone look at your application. That's your the first impression that you're gonna show to the program. So if your letter is like good, then it's like we look at with different eyes.
That's great advice. Dr. Tangatori, do you have anything else you can recommend to our group here?
Yes, so I would 100% second what Dr. Fernanda just said. Networking is the key. Just know the program well and talk to the faculty and your alumni and your other residents who look like you are the key. Is once you contact them, they will have more information about the program offhand, on-hand, everything. And that's how you choose your programs rather than doing a blanket application, throwing it in there. Second thing, when you're finally deciding, once you've interviewed and ranking the process, I would say what Dr. Thirssary said, like choose a place where you can be close. If you have a family member, just be close to them. And of course, your interest should be the priority. Like when I chose my programs, I ranked irrespective of the visa status. I'm on a visa, but as for the visa status, I chose the best program I fit into. And what my subspecialty interests were. And fortunately, my family was close to the program, so I was able to match. It's not always possible because having a family close by to your residency is very helpful, because it's there is stress, and like it's nice. You have a weekend off that you can visit the family. It's nice. It's good for your mental health also.
Great. That's all great advice. I think, obviously for all of you that are applying this cycle, kind of really thinking ahead of time about what your priorities are. So for many of our panelists, geography and family and people they knew played a role in that, networking, as well as specifics about the program schedule and subspecialties, and also looking at sort of the composition of the program faculty, looking at the different subspecialties, looking at their training backgrounds, and just kind of seeing, kind of doing that research up front to kind of really narrow down somewhere where you would, where you would prioritize, where you think you would feel comfortable and where you would, feel supported and feel like you could thrive in your career path. And that's something, I can only speak for myself as a program director. So I'm going to try to start answering some of the questions that you all submitted that have more to do with sort of application review and details about that. But just to kind of give you the caveat that, obviously every program director might be slightly different in terms of how they approach applications, how they weight different factors. But the goal for all of us is really to, really we all want, as program directors, we all want to, be selecting applicants that are really excited about neurology and are really, enthusiastic about learning our field and becoming specialists and really, sort of adding to our specialty, whether it be via clinical work or, scholarly activity or a combination of that we're really looking for that interest and desire within our field. So that's something I think that we all have across the board. And then different programs vary in terms of what, sort of what they're looking for based on the type of training program they have. So like Dr. Thirssary said, some programs are a lot more sort of research heavy during training. They have a lot of graduates that are looking to, write K awards and, pursue, basic science or primarily, science careers. But not all programs are like that. And many of them are really more sort of clinically oriented. And really the key is to, see as much as you can prior to applying and, based on what your career interests are. But, so that's really the main thing that, goes across the board is really your interest and enthusiasm for this career path. The other thing is that we're really looking, and if you can kind of sort of think about it from the perspective of either a program director or a faculty that is reviewing your application. So I think that might help to kind of put things in better perspective in terms of what we're looking for, because a lot of the questions were very specific about if I have one letter in neurology and one in research, what should the third letter be? Like a lot of questions come up that are really specific. And I'd like you to sort of take a step back and, put yourself in the shoes of a faculty or a program director that's looking for residents that are going to succeed in their program. So that's really what I'm looking for. I'm looking for a resident who's really enthusiastic, someone who will excel in our training program and really add to it, sort of add to our program, add to our learning environment, and really be able to take advantage of the opportunities that our program has to offer, which are many. So, in reading the application, there's not one single thing. So when we talk about holistic review, that means there's not a specific, score cutoff. A lot of people are asking about like age cutoffs, year of graduation, specific scores on step 1 or step 2 CK, et cetera, specific letters of recommendation from a certain specialty. So in reviewing the application as a whole, there isn't one single criteria that is let's filter this and, toss all the applications of anybody that had this year of graduation or earlier from medical school. So that's not how we're looking at applications. So when I'm looking at an application, I'm taking the viewpoint of I want to pick applicants to interview who either by reading their application, I really want to meet them. So that's something. So as a baseline, you need to sort of show that you're interested in being a neurologist. So that needs to come across in your application. And that can happen in a number of ways. So that can happen, and it doesn't have to be all of them. It really has to be based on your interest. So, but there needs to be something. And I assume that as a neurology applicant, there are reasons why you're interested in neurology, and there are experiences that you've had either via clinical rotations, via research experiences, via other types of work, or you name it, other types of residency training that you've had that you can show programs why you're interested in neurology and sort of what you're interested in learning more about as you pursue your career. So that's really something, that can be shown in multiple ways. So if I think as Shivani said, she was able to do some electives in neurology, but some of her friends weren't able to come to the US because of the pandemic, but they were able to work with a neurologist at their medical school and, show that they had some experiences in neurology. So I think there's not one set thing that programs are looking for or one specific set of things that you can list on your CV that will make it so that it's a guarantee to match. It's really you looking for a program that's a good fit for your career goals, that you will also enjoy and really thrive in during the 4 years that you're there, right? So I'll just to kind of go through the list. So one of the questions, there were a few questions about age. And so in application review, we don't discriminate based on age or gender. And there were a couple of questions about gender, which I thought was interesting, whether we consider that independently. And I never have. I think, the number of applications that I've gotten over the last 12 or 13 years as a program director are pretty evenly split 50-50. And overall, we've had some years where just we happen to match. We had one class of 5 women. And our current PGY1 class is 6 men and 1 woman. Like it's just, but if you look at the rank list, it's really pretty much 50-50. It's not something that I'm trying to make sure that it's, 50-50 just because the applications are pretty evenly spread out. The gender disparities in neurology really become more apparent at more senior levels in academics. So the number of women versus men at associate or full professor level, you can definitely see that that there's a difference there. But I think in terms of sort of the entry level, entering into training, I haven't seen a big difference. Age, we definitely don't discriminate. There were several questions about previous neurology residency training, which I would like to say, just in my personal opinion, if anything, that's definitely shows your desire to be a neurologist if you are a neurologist already in your home country. So that is something that we have had several residents go through our program, having trained in neurology in quite a few different countries. In India, we had someone. We've had several who've trained in Brazil who've done residency already, but several countries, Armenia. And I think if anything, that shows the fact that you're willing to retrain in residency in the US to continue your career. If anything, I feel like that's something that wouldn't count against you in any way. In terms of year of graduation, that was the other thing, that there were a lot of people who sent in questions about year of medical school graduation and sort of gaps in training or gaps in clinical experiences. And so when I'm looking at that specifically, I'm still, again, so if you take sort of it in my shoes, I want to make sure that I am selecting applicants who are prepared for the clinical training, right? So, it doesn't necessarily matter what year you graduated from medical school. It depends on what you've been doing in that time, right? So if I have somebody who hasn't touched a patient in 10 years, I'm going to be concerned about their PGY1. What if they start off in the ICU as a medical intern? That 10-year gap is going to really, things have changed in ICU care. Like, I'm going to have some concern about their clinical preparation for starting out on the wards as a medicine intern, right? So I'm kind of thinking about it in terms of what are the clinical experiences. So if somebody has been continuing to see patients, or, been working in a hospital, or, has stayed active clinically, and can sort of show that they, especially with more recent letters of recommendation, that they're able to, that they're currently sort of up to date on clinical practice, especially in medicine, then I have less concern about whether or not they would be prepared. So hopefully that kind of answers that. So that's the reason why we don't have a specific cutoff for medical school graduation date. And I do look to see what people have been doing in the interim. So, but it's not, not something that we filter out based on. The other questions, there were several questions about virtual clerkships. So one of the questions I believe was asking, is it comparable? And obviously it's not the same. So if you were to do a virtual experience, that's not going to be the same thing as doing an in-person sub-internship, right? It's really just not the same thing, but it's better than nothing, right? So it's better than not having done a clerkship at all. So I think if I see that somebody has done a virtual experience, or has, because there were several that were offered last year, and I did get letters of recommendation from some of them. And depending on what the experience was, it still was helpful to get information in terms of that applicant having more exposure to neurology patients. And it was something we discussed in the interview, as well as their letter of recommendation. If it was some type of virtual experience where their letter writer could really sort of comment on their, their patient presentations, their communication skills, their professionalism, and aspects of their clinical care, then it was very helpful. Was it the same thing? No, but that type of virtual experience still was able to provide programs with helpful information about how about your clinical skills and communication professionalism. So I think if you do have the means or the opportunity to have one of those experiences, I think it can also be helpful to you, just sort of as developing as a clinician. So I think that's almost more important as well. So the more you can get exposure to neurology as a specialty, even if it's virtual, if it's that versus not having an option, I would definitely go for it and try to, take advantage of the types of experiences you can find. I just have a list. So the research and work experience, that was also a question that came up quite a few times. And like Dr. Thirssary and several of our panelists said, it really depends on what your interests are. So if you are somebody that has research experience and it's really shaped who you are and it's something you want to pursue, that's an important component of your application, because that's an important part of sort of your identity and your career goals. But it's not a requirement. So not everybody who's a neurologist has research interest, okay? It might be that, you have other interests, other scholarly interests or clinical interests within neurology that you feel passionate about. And it's important for you to really communicate those in your application. I don't know, at least I don't, if I see the research section and there's not much there, or there's not a specific neurology lab that you worked in, that's not something that is going to eliminate your application from the pile. But I do want to see in other areas of your application, areas that you are interested in, things that, if it's not research, that it's some other type of area of either scholarly pursuit or clinical passion or something that is, that shows me your interest sort of career-wise. But I don't think that research or number of research experiences or having a manuscript or having 2 posters versus 12 posters or like 1 case report versus 50 case reports is really something that necessarily is going to differentiate you from other applicants. It's really sort of that whole picture, if that makes sense. And hopefully that's reassuring to some of you, if not all of you here in this webinar are, have career goals of being, academic science clinician scientists, because that's, not, there are some programs out there that are looking for clinician scientists, but the vast majority are looking for strong, well-rounded clinicians. So the other thing that came up several times is in terms of, I guess, what people call red flags. I feel like there's probably a better term for that. I don't know, but I guess for addressing parts of their application that they feel that may detract or may stand out as something that might cause somebody to, not pursue an interview with them. So, and usually those things are, failing tests. So either one of, the step 1 or the step 2 CK or the CS, or having, I guess, areas of academic deficiency on their transcript, or, just some spot of their application that sort of needs to be addressed. And I do, as a program director, think that if there is something that stands out as a potential problem on your application, that it is something that you should not, write up an excuse for, but really sort of reflect on and be able to explain in your application, either, and there's a lot of different reasons why somebody may have failed the test, right? So I can't tell you what they all are, but, if somebody had, a terrible situation come up or something unexpected, if that's the reason, there's not a problem with explaining that. Or if it's a trouble with test taking itself. So if test taking has been an issue in terms of either test taking anxiety or trouble with some aspect of multiple choice test taking, things like that, and that resulted in like a poor step 1 score or a step 1 failure, then having an explanation of that and what you did to remedy that is probably, actually reflects really well on you. And especially if you are able to do well on step 2 CK. So for me, seeing that somebody did poorly on step 1, but did amazing on step 2 CK actually is a very positive aspect of an application to me, because it shows me that if there was some issue with test taking, especially if they explain it, and then they were able to sort of adjust their study style or able to, address whatever issue was going on. And then they were able to either, able to perform well on tests after that, then that I think shows sort of resilience and able to address and sort of take feedback and, improve on yourself. So, I think it depends on, it definitely depends on the circumstance. So hopefully that helps answer sort of the red flags question. And then lastly, a question that came up in terms of, there are a lot of questions about strengthening your CV. And I think I remember Dr. Thirssary mentioned that as well. So it's really not about what can I add to my CV that will make me a better applicant. It's really thinking about what is, and I think mentoring probably will help in this regard. So if you are able to have a mentor or even more than one mentor that can sort of help you kind of think about your career and what your goals are, I think that's really a good way to look at it, not as, what line can I add to my CV that will make me have a better chance of matching? It's what am I interested in, and what are my passions in terms of being a physician, being a neurologist, and what are some things that I'm interested in that will help add to my career, but, also hopefully as a benefit, add to your, overall application and your CV. And then, sorry, I know we're running out of time soon, and you guys had a lot of questions. So, and in terms of scores, obviously it's important for program directors to be able to do the holistic review. So again, no cutoffs. Step one is pass fail. I mean, it is what it is. So we can only review the information we have. So if we don't have step one anymore, it's, we just see that you passed it and that's required to pass. Obviously, we're going to be reviewing all of the information that we have in front of us. So it's hard to say how that affects each individual program director. And then I do want to give our panelists a chance to add last words if they want to, but there were a couple of questions that I thought were really great. Basically, one of them are some, how does reviewing IMG applicants differ from reviewing AMG applicants? That was a question that came, and I thought that was interesting. Obviously, in reviewing applications from non-US IMGs, it requires, I think, more experience from the part of the program. So one of the things that's helpful is having a diverse international faculty. So if I have multiple faculty members who trained in India, they've actually over the years really helped me learn a lot about the medical training. And I'm just giving India as an example because we have like probably faculty from, I think, 10 to 15 different countries that I interact with on a regular basis. And I look to them sometimes for learning more about the medical system, the medical education system in that country, the different medical schools and what are their strengths of the different schools, the rotating internships that are done afterwards, sort of what does that entail? So I've learned a lot about what training is like in medical education in a lot of different countries over my years of doing this. So I think that's something that's definitely helpful in being able to do a holistic review and really be able to understand what somebody's background is like and what their previous clinical training is like by just having that experience and learning more about it. And I want to get to one last question, which had to do with visas. Okay, so someone asked a great question about whether or not needing a J1 versus having a green card already is going to be a significant benefit to their application. And I think for some programs it might. So I think, I hate to say it, but I think that a lot of programs are scared about travel restrictions. I'm not, and I think the more we can be aware, the better. So the fact is that our J1 on-time arrival rate for neurology residents this past year was over 95%. So we have nothing to worry about as programs. Okay, so I'm always in touch with the ECFMG. I've worked with them closely over the past decade. And, the on-time arrival rate, even during COVID, when borders were closed, we were able to get all 7 of our interns here within the first week. We had, a little bit of delays with quarantining because people had to wait the 14 days. So we had a little bit of delays with that, but big picture, like everybody got here, even during COVID with borders closed. The on-time J1 arrival has historically been well over 90% for us as a field as a whole. So from my perspective, I do not, I don't worry, obviously weird situations have come up and you name it, I've probably dealt with it in the last 12 years. And I'm always surprised by something, but, I think big picture, if you need a J1, chances are you will be able to get it and start training on time. There have been very few issues with that, even with COVID. So I wouldn't worry too much about that. Do I think that some programs I think that there probably are programs out there that aren't completely attuned to that. I try to communicate that as much as I can as a leader within the program director community. That's one of the things that's been important to me, is to communicate that, and also have program directors, specifically newer ones, understand immigration and understand both the process of getting a J1, what we need to do as program directors, and also the waiver process afterwards. And that's something that for me personally, I've done training with other program directors, chairmen of departments and neurology departments, so that they're sort of up to date on all that. But I don't think everybody's up to date on it, but I hope they will be. So I thought that that was a great question. It's just about 9 o'clock. So I want to and I'm sorry I didn't have time to get to the chat, and I didn't have time to get to every single one of your questions, but hopefully I hit on the ones that were like sort of the most common themes. But for our panelists, do any of you have anything else that you want to add for applicants this morning?
I was going to say, to summarize the whole thing, I think you have to, as Dr. Schuyler said, put yourself out as, who you are as a person. Life is not a standardized test. It's not, your CV is not who you totally are. I think there's more about what's there on your CV rather than that. I think we want to understand and know why about the things that has brought you here. I'm pretty sure each of us on this webinar have our own journeys in terms of, what has brought us here. The path is not easy for anybody, but I think that's what we want to know about a person and know about an applicant. And I feel that's where it kind of boils down to being genuine about yourself as to who you are, and then using all the resources that you can have in terms of networking. And I think social media, especially in the past few years, especially now accelerated by the COVID pandemic, those are great resources. Reach out to people. Again, I think it as all of us have mentioned probably multiple times, it is about finding the best fit for you. And I think it is very helpful if you can have a perspective as to what the program is looking towards, and that might help you frame things better as to, how are you kind of putting everything together in terms of your application, not just your CVs and letters, but your personal statements and everything else that kind of reflects on who you are.
Great. Well, thank you so much. I am so appreciative of all of you that have stuck with us this morning. And I hope that this information was helpful to all of you. I wish you all the best of luck in finding the program that is the best fit for you and in your future careers as neurologists. So thank you for joining us. And if you are interested in our program, I welcome you to join one of our virtual open house programs in the next couple of weeks. And I look forward to reviewing all your applications.